Good morning, everyone. First of all, thank you so much for uh, sharing your precious time with Muskan and myself, Dr. Minal Sharma. I'm senior resident expert at Muskan.ai. We are going to discuss about artificial intelligence in dental radiography. As we all know that X-rays or dental X-rays are very important role in the diagnosis and the treatment planning for any dental treatment. So here what we are going to discuss in very simple and easy path that how AI will help in the routine dentistry, where usually in the clinical practice we take X-rays on and off to explain the patient what is the problem and what is the clinical implication. We can use it to make our practice easy and we can work in a better way. So, shall we start? So, as per the announces, the Google has announced about the new generative AI and the capability of how it will helpful for the doctors, especially the medical healthcare, the overall healthcare, it is keep on changing. The new evolutions are happening. And as per the Harvard Medical School and the research is that Microsoft will introduce new data and AI solutions to help the healthcare organization because it will help to the clinician and to a patient simultaneously to explain what is the problem uh, and to make the patient aware that what all things can be done if it is done, the detection is done in the early stage. So start from the prevention or the early diagnosis to end towards the treatment. So the complete journey will is going to be helpful with the chat GPT was there, but now new generative AI will be helpful for the doctors in the medical healthcare. So and with this perspective, we are going to introduce in dental healthcare also. Next. Because everyone is aware about the what is chat GPT and how the now AI or generative AI will be helpful. And if as per the current situation and the market size, so we all know that how AI is already we are using in day-to-day life and in the medical healthcare already as per the multiple studies are going on in the US market and how it will helpful from this year to the coming years, all the strategies data we have gathered from the different sites. And as we all can see that in the next 10 years, the complete huge revolution is going to be there with the help of artificial intelligence. And it will gradually, it will help with the routine practice to utilize the chat GPT, generative AI, and it will helpful in the various aspects of the healthcare. Next. As per ADA, American Dental Association, we know that we have various specialties of the dentistry, and one is AI ML and the generative AI. So now in the simple language, like what is artificial intelligence and machine learning? And it is AI/ML is the one word, but it is combination of multiple things. It is machine learning. It will include the deep learning. It is various parts of the deep learning and various neural networks and the computer vision. So once our uh, human knowledge or human brains will train a machine to reach to the specific goals or to give any kind of provisional diagnosis. So we, being a human beings, we can do a machine learning and we can train a model in such a way that it will be act as a digital assistant, and it will be helpful in the all aspects of the start from the diagnosis or till the treatment plan. So that is AIML, and Muskan is has been working as a team with, for the AIML at the different parts of the medical healthcare also, and specifically in the dental hygiene and the dental radiography also. Next. So here, let's now talk about the frequently discussed questions like usually what we have heard that the AIML, either it will, what is the correct statement? We have, we can see here, we have jotted down the four statements like AI will never outsmart the human intelligence, or AI will not be able to outsmart the human intelligence in the future, or AI will outsmart the human intelligence in next coming years, 2050, or already AI has outsmarted the human intelligence. So here I would like to ask or take a poll in the all the doctors and the dentists. So anybody can share their suggestions or they can give their feedback that what do they think, or in the chat box they can write whether what they think about the AI.
So Dr. Minal, yeah, so everyone, hi. I think we have a polls opened in, like, if you can see that
Okay.
option at the top. Yeah. So you can kind of
Okay.
give your suggestions or your answers on that question. So that way it will help us like see what everyone is thinking. Yeah.
Yeah. Uh, so here I can see. So there are mixed answers are there, and first of all, I would like to do a few clarifications that it is not a replace. AI will not replace a dentist. It will act as a digital assistant. So once we have technology, we can blend it with the our own knowledge and the practice, and it will we can outreach or we can do multiple things with the AIML, and we can reach out to multiple people. We give good treatments and make awareness in the patients. So already in the day-to-day life, we are already using AIML at different aspects, but we are not aware about it that yes, it is AIML. Let it be any aspect. The next slide is I'm going to speak on that only. Next slide. Next. So in day-to-day life, how the routine the AI is there start from the medical healthcare, medical field, the business, or routinely what we are using it in the whenever if even if for the let it be the banking, let it be entertainment, whatever we do a Google research, the way we are using a Google Maps, and gradually it is accuracy is increasing. Earlier, for example, WhatsApp. Earlier there was only limited features, but now we have multiple features in WhatsApp also. It is just an example, and let it be e-commerce or let it be creativity, let it be anywhere. For example, with the for example ICICI Bank. Usually, I have an account of ICICI Bank, so I can give example that Ria, she comes as a digital assistant. I mean, whatever questions we have, we usually ask, and it will reduce the time, it will reduce the resources and the manpower, and that can be utilized. That manpower or resources can be utilized in the better way, in the better position to get a more outcome, and practically it will helpful and to gain or to achieve better things towards the practice, because dentistry is there are different kind of procedures, and being a clinicians, everyone knows that uh, sometimes it is difficulty to make the patient understand, or how to convince them, or how to make them understand that what it is, X-rays especially. So definitely, when once we are using it in a routine life, so if we can incorporate in the dental practice, so it will give a great results, and the transformation will be amazing. Next. So as we all know, the current situation in the India and the globally, because as everywhere or the all parts of India, there are different kinds of practice is going on. There are different kind of mindset of the people is there, and dental health is already neglected. As per the studies and the MIT studies, that initial cavity detection is missed in the more than a 40% of the cases. And it gradually, once we all, and people have that misconception that medicines will cure all the problems of the teeth. So I can say, or that in the different parts of India, whosoever is doing practice, say small setup to the higher, or the multi super specialty setup, that if there is a, if we or being a clinician wants to make the patient understand that or cavity will not be cleaned by a brushing, because even in this modern era, uh, people are educated, many in the rural area also. So these one common problem is there, that patient would like to understand. They can understand with images. They are techno savvy. They are more on the Insta, on the Facebook. They keep on putting reels and everything. They will come with the Google knowledge also. So in this area, with this current situation, if we can do something with the, or for the betterment with the AI, then definitely it will going to be helpful. Next. So if we say overall in the healthcare, how the AI is going to be helpful and why it should be used, because as we all know that how health is important. Number one is overall health. Start from the basic routine, say BMR ratio, or overall health. First, people will look after for the overall health, even if there is small pain. And pain is a big question. If there is a symptoms, there is a pain, let it be general health or the dental health. The patient is going to visit when there is a pain. But when there is no pain, and for example, after the first treatment of the root canal, first sitting of the root, if once it is gone, then patient will not visit to a dentist. That it is gone, the pain is gone. So with that, if we can with the or the normal routine, the practice, if we can inculcate the what it can be leverage the AI, that it will helpful in the, say, diagnosis. Like for example, there are multiple studies in India only. There are multiple studies which are going on for the different parts of the cancer. In the women's, we all know that breast cancer, the cervical cancer, or the ratio is gradually it's increasing, and screening has to be done. Just for example, so if this screening can be done so easy that it can be accessible to all the patients so easily, so definitely it will the diagnosis, the accuracy will automatically will increase. And if it will increase the treatment, the quality of the treatment, what we want to give it to patient, it is automatically will increase than the it is doing with the normal way. Next. And if we if we talk about the specifically for the dental care, so being a dental surgeon, we all know that there are total 8 specialties of the dentistry, and each one of them plays a very important role in each aspects. It is not only about, say, if we don't do the awareness, then how will be the impact? If we do not do that conservative treatment properly, how will be the impact? If malalignment for the different generations. If it is a cosmetic treatment, it is for specific generations. But everyone wants to look good, want a good teeth. But if we can tell them that how it is going to be helpful with the AI or with the artificial intelligence, then it is going to be very useful for the clinician or for the dentist uh, to make patient aware that you have the problem, or it should be so easy. It should be on the few clicks of the buttons. If we can make accessible to a patient in such a way that they don't have to waste time to going and coming for the each and every visit. If we can make it digitalization in such a way that it should be as simple as to send a message on the WhatsApp or hi or hello, or we see a patient that if they can use it WhatsApp or the social media like so easily to communicate, then why not communication with the dentist? Why can't we give such a platform that they can utilize for the dentist in such a way that early detection, if we give the AI platform will give in the simple way, let it be the small sector to the bigger sectors in such a way that it will click only the few minutes and the report is ready. Then definitely start from again. I repeat myself that if the few clicks, if we can go give the more and more information, then it will be helpful. Next. So, as for the continue with the discussion, or say without AI, we have done a lot of studies and a lot of articles, and its research is going on since past 5 years. We have seen the lot of studies and the review articles has been done, and with that, we can say that the how the percentage will be decreased without the AI, the acceptance of the treatment, or let it be for the basic common problem, the conservative, the perio problem, the restorative problem. So overall, and sometimes human error can also be there. The way we do sometimes problem in the iatrogenic treatments. So if without AI and with AI, if we do a comparison, so definitely gradually it will give a positive impact. Next slide. Yes. And why, as I have told that AI will act as assistant or digital assistant. As we all know that dental procedures require, it gives a better way of treatment when we are doing with the assistant. I think if we would like to do a good treatment to a patient, so for example, practically we require a suction, or that or our assistant should be doing it, or should everything should be ready. If we and then we can check, okay, this is not correct, you put this. So in the same way, so this is digital assistant will help. Specifically, if we talk about the X-rays or the IOPs and OPGs in the demo, you'll come to know that if out of 10, if the 8 findings AI is giving, okay, doctor, this is the AI will say, oh, these are the findings, and we can add on to it. Then definitely it will save time. We can give a more better treatment to a patient. The way we train our human assistant, but we can train our AI. It will act as a digital assistant much better way and more efficient way. So start from the acceptance to a patient. So it definitely it will increase. Once the acceptance will increase, automatically the treatment will be better and prognosis will be better. Next. So if we use for the acceptance by the patient, now think about the patient point of view. We see a lot of patients in a day. But if we explain to patient, most of the patient, I can, if anybody agrees or if anybody would like to say something on this, that if I say a patient, you will require a root canal. So he will say, why? I don't require root canal. You do a filling only. I'm not going to go for any painful treatment. So to check, and usually we to take a X-ray. So if we give this interpretation to a patient in a color coding way with the AI, so it will be going to be very helpful. Number one, pictorial view is easy to understand, and coloring view. So these two things will make the patient understand that this is and the gray and white. For a patient, everything is gray or black. We know that what is a color of the enamel and a dentine and the pulp, but how they will recognize it. So if we can make it in simple way, the acceptance will be more with the AI. And why it is more, so we'll have a small demo during after the session, so you can understand better. Next. So let's unravel the in the various aspects. So here, if we have different specialities, we have general dentists also. Most of the people, there are multiple types of practice. So in each specialty, it will act as a on a different way. And gradually, as we all know that it is coming to a robotics. In the surgeries, I can say the robotic surgeons or the robotic surgeries is very common. Definitely, we have to do some modification gradually. The way we have come to the normal phone to smartphone, so it will take some time to everyone to understand that unless until we use it. So unless and until you go, we can think about it. We have to try something which is new, and then we can utilize it in the practice. Next. So, for example, for the specifically for the oral pathology, if we AI in the oral pathology, so we have the early detection is very important. If we can give a better early detection, and early detection can be done in the multiple ways. Say, for example, the OPNDs or say any other pathology, which is because oral pathology has various aspects. It's a huge classification. So the early detection will give better prognosis, and AI will give a benefits for the which it can be done in the mass screening because it is very important. Early detection can be done in the screening, and most of the time we forgot to do a screening of the regular patients. Each and every aspect of the India, there is a specific pathology which is common. For example, Gujarat and Maharashtra state has a or the different parts of India, the Ericanet chewing is more common. So the fibrosis, the initial stage of fibrosis, or say the OPND, the red and white lesion, that is sometimes it is more common in the particular area. If during the mass screening we can guide the patient, we can do a tobacco cessation event with this. So then why not? It will be helpful for the patients, and it will improve the accuracy. So CNN and ANA, it's a part of the AI. It's a different all the types of the neural networks. So it will helpful for the ultimate results. Next. As far as for the radiology, so definitely as we have talked about that once the patient comes with the problem, or they can contact you with the problem. Okay, I have this problem, or they sometimes during the COVID time they have a see click the images and they will send, okay, I have this problem. So it will help for start from the diagnosis. Then once the interpretation is done in the proper way, it is easy to understand. Then the X-rays are right now, it is sometimes complicated to make a patient understand. So gradually it can improve the learning in such a way that it will give diagnosis for the other anatomical structures also, because dental radiology or radiology is a huge term. It has a lot of factors, and what all things we are going to do initially, the detection of the few things, and gradually we have a plan that we can do more and more on this anatomical. the sinuses, the mandibular canals, and these treatments will be given to a patient, personalized treatment, because everyone has a different kind of bone loss, different kind of treatment plan. So it can be given as a work as an ecosystem. Next. So as we have talked about the different specialities, so let it be perio. Perio is sometimes a neglected branch because patient come with the severe bone loss, or they have a misconception. If I get the teeth cleaned done, my teeth will start shaking. These are the common problems. So if we can see, give them this coding that this is the level of the bone, and this can be the level of the bone will go down in such a way, definitely it will go make an impact that something what my dentist is trying to make me understand that is important. Why graft? Why surgery? Why rehabilitation is important? To make a patient understand that if this is a normal and this is abnormal, this is a treatment for abnormal, why it is required. So in that way, it is a help. Next. Because we know that the general dental anatomy or how it is with the normal enamel and how is the normal bone, the basic structure, enamel, dentin, pulp, bone. So these things, what is normal, we know it. But how to communicate, how to deliver this thing to a patient? Because once a consultation is done, then patient will take medicine, they will go. Why to do this? So this the color coding will make things easy. The red is this problem, yellow is this problem, pink is this problem, or this is not a matching thing. Next, caries detection. So caries or the cavities, decay. So these are the very common things and common problems. If we see the studies start from the young generation to the elder one, or the care is at the initial stage and it is asymptomatic. If we have a patient, usually we try to make them understand if you have a, this is list of the problems. Cavity does not have a sometimes it does most of the it does initial stage it does not give a problem. So patient will not say I don't want to get it filling done or I don't want to get it done. It's not paining, let it be. But the color of the in the X-ray it will give a good color of the decay. Okay, this is not a, this is a problem. The yellow color you can see, or this is a cavity. So it will give a better impact to a patient when you give a treatment plan. Next, intraoral image. Usually we can see that intraoral cameras we are using it. Nowadays it is in a practice that we use intraoral cameras for multiple cases, digital impressions. So, how it will helpful if we compare the digital camera uh, image and with the X-rays, that this is the level, this is the problem, then it can be comparison can be done with the AI. Next, by please. Usually nowadays we use less amount of the bite wings, but sometimes it has a specific conditions where the bite wings are helpful to check this specifically for the bone loss. There are multiple types of bone loss, say, and the vertical, the horizontal, the angular bone loss. So these kind of things will have how the oral hygiene can be a better. And the patient and dentist connection will be joined for a long time that he and in such a way that patient will come with a positive attitude or the positive mindset because he is more understanding the problems. Next, OPGs. The most common technique of the or the part of the radiograph what we use, let it be any treatment. Nowadays, many clinicians have OPG machines in the clinics. And whatever machines or the companies are giving all the features, but it does not give the interpretation. And when we give an interpretation with the AI, with the list out of the problems, here you can see the color coding. So definitely it will helpful that, okay, 16 this, 26 this, 27 is this problem. This is the problems of the list of the problems. And something has to be add on to it. We can always add on to it. Because as I told that, as I earlier I mentioned that we can always add on to or minus. We have something in our hand and to plus or minus, it will easy. It will easy. Mind will be fresh when you are working on the patient. To convince the patient, to do detections, to plan treatment. Planning is done, we can give more time to a treatment. Next. As per the operative dentistry, and here what integrated AI-based radio, what right now we are, our model is able to do the following things. In the type of the image, like OPGs or the periapicals and the conditions. These many conditions we can right now we can the AI model can is trained for specific the basic all the dental conditions, and it is inculcated. We have given the PMS system also. So patient management system in the will be there with the AI. So it will be helpful how to make every it will be ecosystem. So with because radiographs it plays a vital role in the dentistry. Sometimes it can change the complete treatment plan. Let it be restorative, let it be rehabilitation with the implants, let it be grafting. Before CBCT and OPG and X, these two things, the IOPS, it plays for interiors definitely. Sometimes we want to see the IOPS. So for the interiors, IOPs are more useful, and for overall oral hygiene or the to check the oral conditions, OPG is more better, which is better options. So these are the common what we can give recommendations, the summarized reports, the findings. So everything, if it can be there, it can be there with the AI with a few clicks. Then why not? Why should not we try it? Next. So a quick demo will give you about the since last few minutes I've been talking about it can be what all things can be done. We can see here practically with the small demo. So we'll start with the small demo now. Arsh, I request you to start with the demo.
Yeah.
Thank you.
Can you see my screen?
Yes.
Okay. So this is our application. Here we have the dashboard. So in the dashboard, it gives a uh, glimpse about the patients who all are coming today and what all things are required there, like are they needing any perio maintenance, scaling, endo, restoration, impaction. So this is just a dashboard, like I said. It will give you the insights about who's going to come today, about the appointments and everything. Then we have a schedule page. Here we have today's schedule, like the agenda and everything. From here, you can create a new appointment with a patient if you already know, or if the patient has already, like we have our own mobile app also. So from there as well, patient can schedule their appointments. So whatever appointment that are being scheduled, they will be coming up here like this. So I'll go ahead and create another appointment. So we start by selecting the patient name, the doctor name, maybe today at 14:30, half an hour appointment, maybe for review for scanning. We add a description, we create the appointment. So the appointment will be created. We have this here. We can click on it and we will see the details about the patient, about the appointment. We have the patient view also. So here we can see there are two patients that are going to come today. There are two appointments. So the name, the doctor name, the clinic, when the appointment is going to start, and when the appointment is going to end. Here we have annotate and files option where we can see the files associated with that patient. So these are the files associated with the, this guy. Here we have actions, so we can edit the appointment. Maybe we want to prepone it, postpone it, however we want. Maybe we want to delete it. So the patient can say he is not going to come and we delete the appointment. So we click on annotate. Here it will take us to the tool. So this is our tool. Basically, here we have our uh, the OBGs or the X-rays. The highlights that you are seeing are basically the detection that the AI has done. Here we have a like a this area where all the tools are visible, and these highlights basically tell this tooth has problem. Here we have the findings and everything. So whatever is detected by the AI, we have it. This is a toolbar from where we can make it full screen, zoom in, zoom out. So just the toolbar, we have the contrast. So sometimes what happens is either X-rays are overexposed or underexposed. So we can control the brightness and contrast so that we can be like we can adjust the brightness and everything to get more visibility. We have a magnifying glass here so that we can magnify at a particular area. We have opacity, like the mask opacity. Right. Right. From here, we can control like how much opacity we want, so that if we want to see the original image and if we want to see the current the detection with the detection, so we can control this also. We have the idol mask. So from here, like I said, we can click on the tooth number. So 18. Here we have a filling detected. So this is a filling. At 15, we have a missing tooth. Here we have a caries. So this is 15, this is caries. Filling, and we have a root canal operation here. And whatever is detected by the AI, it will have an AI tag like this. You can accept that, dismiss it. You can add comments for collaboration. Maybe you want to come back later and add some uh, notes and everything. And since it is a AI, it's a technology, it can miss things. Then what you can do is you are doctors, you have more experience. So you can tell the AI, like give a feedback. Let's say the crown is missing at tooth number 11. So it will add that. So if you see at tooth number 11, the crown is added. It's manual, and the AI is being told key next time if you don't miss it. So at 11, there's a crown, and you detect it next time. So basically giving a feedback. Then we support all three systems, FDI, PALM, or Universal. So based on your needs, you can adjust that. Here we have analyze. So if you want to redo the annotation, like reprocess this thing through AI, you can do that. You have the report. A report will be generated with all the data. We have other image here. Um, we can do that as well. Right. So this is on our radiograph. Uh, Here we have the patient, like who all patients are there. Their files and everything. Like if you want to see their files, so these are their files. We can have their images also. Like side. They have the normal images. We can have their reports also, like the PDF report. We can have it in the file section. This is the patient view. From here, you can add more patient. Uh, you can create a patient and you can delete a patient. Like this is how you create a new patient in your PMS or data, like the database. You all these demographics. Then based on the like phone number, what this thing means is when you enter their phone number, it will generate a password, and that patient will be able to use our application, like the Muskan application, with these credentials. So basically, we are onboarding them for our mobile application also. Then we have a chat section. From here, we can contact with the patient. Like we can talk to them. We can do a voice call, video call. We can share images and everything with them, and we can chat with them. This is the email that they have shared. So basically, it's for patient-doctor collaboration. Here we can see if the patient is online or not, and we can do the calls and everything. Then we have an admin section for admins, like I'll show that also. Yeah, we have the user settings like the two-factor authentication and everything like that. So this is a glimpse of our application. Any questions, anything like that we can answer on this?
We can take questions from the doctors now. Any questions if we can answer them, or any queries or thing like that? A few doctors have joined a little late, so if they want, they have something in their mind, they can ask. We're happy to answer all the questions. Any query on concept or anything like that?
Yeah, if anyone has any question, please like raise the hands, or you can. So I, if like you are not able to unmute yourself, I can do that.
So a few doctors have joined just 5 minutes back. Yes, doctor. Anithya, our doctor has raised a hand. Unmute him. Sure. Dr. S.K. Jula.
Okay, I think they have left. I think if there are no questions, then we move ahead.
No, Dr. S.K. Jula, I think he has
I think he
raised
has
a hand.
left. Yeah,
Okay.
he left. Yeah.
Okay. I think he's in. Anita is waiting in the lobby. Yes, Dr. SK, how can you unmute yourself? Anita has joined back, so either he is not able to unmute or there is any problem.
Hello.
Yes, good morning, doctor.
Yes, madam. Madam, I would like to ask a question. Like, if we are using some other software, other platform softwares like Denti or Bestosis, and again we want to use uh, this version, then again like we have to leave that software, or we can continue with both the things.
We can continue with both the things. Arsh, you would like to answer him
Yeah.
regarding the software? Please. Thank you.
Yeah. So entry and the other one you're saying, the PMS, right? So our what we are offering is it's a complete end-to-end solution. Like it's a PMS, it's a radio graph tool and AI tool also. So you have to like move to our thing to use the whole ecosystem, to use the mobile app and everything. If you want to use both, you cannot like you can use it, but it will be challenging. We suggest that you use our own like whole ecosystem so that to use the mobile app as well as this web app. Because those systems they just provide the PMS, right? We are providing a PMS as well as an AI tool, which can help you with the radiographs and everything. Does that answer your query?
Dr. SK, I hope you got an answer or any more queries. So this is a very common question because everyone or the most of the clinics use some or the other software. So I request that if anybody would like to use the platform, then they can reach out to us on the website. We have uh, all the information we shared on the website and on the emails also. So if everyone is busy with their work or something like that, so we can answer the queries later on also. That is not a problem on the emails. We would be very happy to answer all the questions. Okay. Any queries or any questions from other doctors? Uh, Doctors, you can share your queries and feedback and on the Muskan website and email ID info@muskan.ai. We'll be very happy to answer all the queries. And however, doctors wants to use the platform, how to start, when to start, or what all problems you face for the new software or anything like that. So don't worry about those things. We'll happy to answer for that. Thank you so much for joining us.
Yeah, thanks everyone for joining.
Yeah, thank you so much. Okay, thank you.